How do appliances work? You would say by changing the occlusal condition towards a more favorable one. That's it. Right? I'm afraid you're wrong. Hello everyone, this is Dr. Shrivastava. I am practicing Temporomandibular Disorders since last many years extensively and successfully. Let's discuss how do appliances actually work. What are occlusal appliances? They are hard acrylic appliances that fit over occlusal or incisor surface on the one arch and create precise occlusal contacts with teeth of the opposing arch. So that is the reason you might feel must be the effect of the symptom reduction that they produce. Yes, that is one of the mode of action of these appliances, especially when they are targeting muscle disorders that are secondary to occlusal changes. But that is not the only mechanism of action of these appliances. There are at least 6 other mechanisms by which they act, and some of them you will be surprised you do not even think of. The second mechanism of action of most of the appliances is by change in the condylar position that they produce. Consider a deprogrammer or a stabilization appliance. They work by letting the condyle assume a more musculoskeletally stable position, producing a reduction in muscle hyperactivity, and that is the cause of reduction of symptoms. Another mechanism that the repositioning appliance works with is by repositioning the condyle over a more favorable position over the articular disc against the fossa. This produces the relief in symptoms by relieving the retrodiscal tissues. So here it is not the occlusal condition change that is producing the relief of symptoms. It is the change in condylar position that is actually doing the work for us. Another mechanism of action of this appliance is by change in vertical dimension. I suppose all of you know that. A temporary increase in vertical dimension will actually reduce the muscle symptoms, though transiently. This might be the modality of action of some of the appliances. Almost all of them change the vertical dimension and hence reduce muscle activity. A third and supposedly and my favorite is actually a reduction in peripheral sensory input to the central nervous system. This is the most important mode of action of all the appliances. Now what is this? Whenever we produce any change in the occlusal condition, it changes the sensory input to the central nervous system, that is our brain. Now any change in sensory input to the brain prompts a reduction in all the muscle activity. So all the daytime parafunction goes down, the nighttime parafunction goes down, and this is how relief in muscle symptoms is produced. So you might feel that whenever you introduced the occlusal appliance, you actually changed the occlusion. Yes, you did, but you also changed the peripheral input to the central nervous system. And that brought down all the muscle activity and produced relief in symptoms. This is a mechanism of action that is very, very important to consider before planning any of the definitive procedures. Another mode of action that the appliances have is actually cognitive awareness. Whenever we institute any appliance, we instruct the patient to do physical self-regulation. That is, take a softer diet, have smaller bites, slower chewing, and restrict mouth to painless range. All functions are restricted to painless range. With that, we instruct the patient to have lips together and teeth apart. They become aware of all the parafunctional activities they do during the daytime. That is one of the contributing factors that puts down all the muscle hyperactivity and produces the effect. Now, along with that, there are other mechanisms of action like the placebo effect or regression to mean that are also there along with the appliances, but I feel that they are a little less important, and the longer the appliances are instituted, the placebo effect goes down and the regression to mean also goes down. So even if you don't consider the last two, there are other more important points to be considered before we conclude that it is the occlusion condition change that produced the effect. So, surprised? These are all the modalities by which the appliances act, and that is why when the appliances produce relief in symptoms, you should not conclude that it was change in the occlusion condition that brought down the symptoms. Do not institute any permanent, irreversible change after your appliance therapy is successful. You should be absolutely sure of the etiology, the cause of the disorder, before trying to eradicate the cause of the disorder. This is me, Dr. Sanyukta. Hope you liked the information. For more such videos, stay connected to my Facebook group, Demystifying Dentistry, or if you're a dentist. And for all the patients and other people to connect with me, the link is in the description box. Hope you liked the video. Please give a thumbs up if you did. And here's me signing out. Thank you.